The function of the thoracic vertebra are as a main axial support for the body, particularly the skull, thorax and pelvic girdle. This is looking downwards at the anterior part of a vertebra. You can see how it protects the spinal cord, with the nerves branching out the side of it. There is sympathetic ganglia just either side. So far the vertebral column has support and protection. The reason that it's made up of so many different vertebrae is for flexibility. The only region they're not flexible is in the sacral region, because here stability is favoured and the vertebra become fused into the sacral bone. Within the vertebra, the spinal cord is carried through a hollow area called the vertebral canal. The arches are attached, they detach the vertebral canal to the body, here and here, are called the pedicles. The palpable ridge at the back part of the vertebra is the spinous process, and at the side the transverse process. The lamina of the vertebra, that's the back part, has a superior and inferior articular facets, which are parts of the synovial joints that allow the spine to move. Vertebrae also articulate with each other via these two notches here, which are the superior and inferior notch forming the intervertebral foramen. In order to be able to support longitudinal loads, the vertebra bone must be trabecular. This means it's got a lattice structure with a very thin layer of cortical bone on the outside. This structure is idealized for absorbing stress on the structure rather than allowing fracture as if it were solid cortical bone, which would be more brittle, so it's able to absorb the load without breaking. The lamina at the back of the body of the vertebra takes about 25% of the weight, where the body takes about 75%. As the bones are constantly remodelling, if excessive force is placed on the lamina, they can start to take over more of the proportion of body weight, and this can be a problem for posture and lead to compression of the nerves and back pain. The articular facets of each vertebra, the surfaces of which form the movable synovial joints between each vertebra, are at slightly different angles depending on where they are in the spine, allowing a wide range of movement in the cervical vertebra and a much lower range of movement in the lumbar vertebra. The spinous and transverse processes are mainly attachments for muscles. Cervical vertebra contain holes either side of the transverse processes, in between the body and the transverse process, called foramen transversarium. And this is the portal for the veins and arteries of the vertebra, so the vertebral artery, to travel up through towards the head. The foramen is larger, corresponding to the cervical enlargement of the spinal cord that gets nearer the head. The foramen is at its largest by the time it gets to the atlas bone. The foramen is also particularly large around the exit of the nerves forming the brachial plexus, which is also in the cervical vertebra. But if it has these foramen transversarium, that identifies the vertebra as 100% a cervical vertebra. No other vertebra have these. The first palpable lump from the vertebra in the neck is the spinous process of C7, which is the final cervical vertebra. The atlas and axis bones, C1 and C2, provide a slightly wider range of movement than the other cervical vertebrae, allowing for rotation of the head. The cervical facets, the articular facets of the atlas bone, here and here, articulate with the occipital condyle of the skull. And the axis bone contains an upward projecting fovea dentis, which articulates with the odontoid process or dens of the axis bone. It's held in place by a transverse ligament running across the front, which, if broken, can mean that the head and spine go back onto the spinal cord, so it's very, very crucial, very important. And with this cutting off the nerves used for breathing, the vagus nerve, is the mechanism of death when you would kill someone by hanging. And it's also the reason that you shouldn't move anyone's head if they've had a neck injury. An important role of the axis bone in terms of load bearing is that it transfers the weight of the head from being carried on the posterior arch of the atlas bone, which doesn't have a body as such to speak of, into the fuller body of C1, and then the bodies of the rest of the spinal vertebrae, taking the force inward from each wing and then downward. Thoracic vertebrae can be identified by articulations on the transverse process and the spinous process for the ribs, and on the transverse process for the rib. The articulation on the body is just with other vertebra, the one above it. So the articulation on the body is with other vertebra, and on the transverse is with the rib. And on the transverse process is with the above vertebra coming down like this. The rib coming in here. Thoracic vertebrae also have downward facing spines, particularly in the middle. Once you get to the lower vertebra, they face more posteriorly. The key feature is these extra articulations associated with the rib, then we know it's thoracic. Lumbar vertebrae are recognised because they neither have articulations for the rib nor holes for the vertebral arteries. And the only way to tell between an upper and lower lumbar vertebra is that the upper ones have more of a triangular shape like that, whereas the lower ones are oval. But the vertebral foramen is the opposite. So a vertebral foramen of 1 will be oval, but of 5 will be more triangular. The 5 sacral vertebrae become fused by the late 20s, and prior to that you'll see rings of cartilage in between the openings. The 2 wings, or ala, either side act as supportive ribs and are the point of articulation for the sacroiliac joint. The sciatic nerve comes from L4 to S3. Now this joint is a synovial joint with joint fluid, but it permits very little movement, because the only way you can really get movement out of a joint is if a muscle crosses it. In this case it doesn't. And alongside the pubic symphysis at the front, it's said to be a stress relief joint.